Welcome to the Breastfeeding Friendly Community Organization Recognition Program Introductory Webinar, presented by the University of Arizona Cooperative Extension, WIC Breastfeeding Peer Counselor Program, and Cochise Health and Social Services. In the next 7 minutes, you will be introduced to the importance of being a breastfeeding-friendly organization. No matter the size of your organization, you can protect and promote the rights of breastfeeding families. This is your first step. Let's meet our presenters. My name is Daniela Reed-Miller with Cochise Health and Social Services.
Hi, my name is Priscilla Lord with the WIC Breastfeeding Peer Counseling Program.
And I'm Regan Durfus with the University of Arizona Cooperative Extension in Cochise County. All of us are members of the Cochise County Breastfeeding Task Force, along with many other community partners. We have partnered to support local work sites and other places that serve the community to elevate their support for breastfeeding families. We already had a program in place where we worked with child cares to become breastfeeding friendly certified. And based on community feedback, the task force determined it was time to expand outreach to other areas of a breastfeeding mother's life. So, the Breastfeeding Friendly Community Organization Recognition Program was developed.
The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months, with continuation of breastfeeding for 1 year or longer as mutually desired by mother and baby. The following slide shows where Arizona falls in comparison to the national breastfeeding rates and the Healthy People 2020 goal. The study also shows how many millions of dollars we can save in medical costs. Based on the previous chart, many mothers initiate breastfeeding, but many don't continue throughout 6 months. How can your organization help change that statistic? Let's start by considering the benefits of becoming breastfeeding friendly. The payoff is significant. There are more satisfied, loyal employees and cost savings to the business. These savings are seen in such areas as retention of experienced employees and reduction in sick time taken by both moms and dads for children's illnesses. Formula feeding mothers take more than twice the amount of sick days to care for their children than breastfeeding mothers.
Another benefit is also the lower health care and insurance cost. One of the examples is from Mutual of Omaha Lactation Support Program, which led to a retention rate of 83% of their maternity workforce compared to the national average of only 59%. Another study of several companies with lactation programs show a retention rate of 94.2%. All these benefits to the employee can also mean return on investment to your organization.
In order to have happier and healthier employees, milk needs to be removed from the breast. Expressing breast milk lessens the risk of discomfort and infection. The Fair Labor Standards Act is in place to protect a breastfeeding mother's federal rights. It states that an employer shall provide a reasonable break time each time such employee has need to express the milk, and a place other than a bathroom and free from intrusion.
The designation of breastfeeding friendly does not only apply to staff. Your organization may have breastfeeding visitors, patients, clients, or students. Ideally, visitors would have access to a private lactation space. However, this is not a requirement of the Breastfeeding Friendly Recognition Program. It may not be in your organization's capacity to provide the public with a private space, but you can still have a welcoming environment tailored to breastfeeding success as well as visitor satisfaction. Breastfeeding-friendly organizations actively promote Arizona laws that protect breastfeeding mothers. Arizona law states that a mother is entitled to breastfeed in any area of a public place or a place of public accommodation where the mother is otherwise lawfully present. Arizona law also states that indecent exposure does not include an act of breastfeeding by a mother.
So what does it take to be considered breastfeeding friendly? Well, there are 4 main components to it: policy, knowledge, practice, and promotion. A lactation policy exists to protect the rights of breastfeeding mothers. Staff need to be informed of the policy and trained on how to be supportive of breastfeeding mothers. Knowledge is translated into practice. Mothers are in a supportive, judgment-free environment to nurse, and a private space to pump on her body's demand. Finally, the policies and practices are promoted within the agency and outside of it, and resources are available to support breastfeeding mothers. Our program is here to help you implement all these components so you can be recognized as a breastfeeding-friendly organization.
There are many organizations in Cochise County that have already been recognized as breastfeeding friendly, such as Sierra Vista Fire and Medical Services, the Women and Children's Unit at Canyon Vista Medical Center, University of Arizona Sierra Vista campus, and many, many child cares across the county. Is your organization next?
If so, here are your next steps. Schedule an in-person breastfeeding-friendly training or have all staff review the Breastfeeding-Friendly Community Organizations webinar and complete Breastfeeding-Friendly Community Organizations checklist. Contact a team member for the webinar and the checklist. Once training has been completed, you will submit the checklist to one of the team members listed below. At this time, the team will provide any technical assistance needed, and you will receive official signage designating your organization as breastfeeding friendly. Organizations in Cochise County will be awarded official recognition in August at a Cochise County Board of Supervisors meeting. If you have any questions about any of the above, please contact one of the team members. Thank you for watching this introductory webinar. We're looking forward to recognizing your organization as breastfeeding friendly.